Okay, so we're diving deep today into a fascinating area, aesthetic plastic surgery for men.
Yeah, it's a really interesting area that we're seeing a lot more activity, a lot more interest.
Right, you sent over just a ton of information, so we're going to try to kind of condense that today into
hmm
the most useful takeaway points.
Absolutely. It used to be this was really a field dominated by procedures for women, but we're really seeing men taking a much greater interest.
Right, and the information you sent really covers a wide range of procedures, both surgical and non-surgical,
Yes, yes.
which is very interesting to look at that range. And obviously, men and women have different anatomy, so there are some unique considerations there.
Yes. Yeah, so.
So what we're going to do today is kind of give a broad overview
Yep.
of this market and discuss some of the specific procedures that are commonly requested
Okay.
and really focus on those factors that are unique
Sounds good.
to the male patient. So let's start with kind of a broad overview
Okay.
of the market. Men constitute a smaller percentage
Yes.
of the market
Right.
in general.
Yeah.
But it is growing.
Absolutely.
You mentioned in the material you sent that men account for between 7 and 13% of surgical procedures.
Right. Right. Right.
Which is still a significant number.
Right.
But less than women.
Yeah. And then 8 to 9% of non-surgical.
Right. Right.
And so, while those figures are smaller, there is this upward trend that is pretty significant.
Absolutely. And I think a big part of that is just greater awareness and acceptability of it.
Yeah.
As men are becoming more aware of the procedures that are available and they're seeing the results, I think they're more open to it.
Yeah. And you mentioned several specific factors in the material you sent that are really driving this increased interest. One that you mentioned is, men want to maintain a competitive edge
Yeah.
in the workplace. Yeah, especially as people are working longer, they want to stay looking their best and be competitive with younger colleagues.
Right, right. And, there's also just this growing societal acceptance.
Right. I think it's becoming less taboo for men to, admit to having these procedures done.
Yeah, exactly. Exactly. And, another point you brought up was that there's greater awareness of the safety and effectiveness of these treatments now.
Exactly. I think, years ago, there was a lot of maybe skepticism or fear about these procedures. But as technology has advanced and techniques have improved, I think the results are much more natural looking and the safety profile is much better.
Yeah, and you see it more and more. Men in the public eye
Yeah.
are more open about having had work done.
Absolutely. Athletes, actors,
Yeah.
Politicians. So I think that helps to normalize it.
Yeah, exactly, exactly. You also mentioned the grooming industry
Right?
is playing a role here too.
Yeah. I think as men are becoming more interested in taking care of their appearance in general, it's a natural progression to then consider these types of procedures.
Right, right. So it's all kind of feeding into this this growing trend.
Exactly.
And one of the points you emphasize is that it's very important to have a tailored marketing approach to effectively reach this segment of the population.
Yes, because men are not a monolithic group. They have different needs and motivations, and so you have to tailor your message accordingly.
Yeah, you have to segment
Right.
the outreach to resonate with different male profiles.
Right. So, for example, a bodybuilder is going to have different goals than a business executive.
Right, right. And so the way that you market to those two different groups is going to be different.
Absolutely. And I think, one thing that's really important for men is the idea of quick results, minimal downtime. So procedures that offer that are going to be more appealing.
Right. So really emphasize those things when you're talking to male patients.
Absolutely. And I think it's also important to not just focus on the surgical procedures, but also on the non-surgical options.
Right, because that's a huge part of this market as well.
Yes. Yes.
And, men are very interested in those less invasive treatments.
Right. And those could be very effective for, things like wrinkles or improving skin tone.
Yeah, exactly, exactly. So let's move on to surgical considerations now.
Okay.
And, one of the first things that you emphasize is that treating male patients really requires a detailed understanding of their unique anatomy.
Absolutely.
And you made the point that men are statistically less likely to undergo annual health examinations.
Right, right. So it's important to do a thorough medical evaluation before any procedure.
Right. So that's, cardiac, blood pressure, all that kind of stuff.
Right, making sure that they're healthy enough to undergo surgery.
Yeah. And also, you mentioned screening for sleep apnea.
Yes, that's important because sleep apnea can increase the risks during and after surgery.
Yeah. Okay. Okay. So let's talk about specific procedures.
Okay.
Now, starting with facelift.
Okay.
That was number 7 on the list of most common
Right, right.
surgical procedures. So it
Yeah.
is something that that is requested.
Yes, definitely.
But there are a number of anatomical differences
Right.
to keep in mind with men.
Absolutely. I mean, the male face is different from the female face
Yeah.
in many ways.
Yeah.
And so you have to tailor your approach accordingly.
Yeah. So first of all, men typically have thicker skin
Yes, that's right.
than women.
Which can actually make the surgery a little bit easier in some ways because the skin is more resilient.
Oh, interesting.
But it also means that the incisions have to be placed carefully so that they heal well and don't leave visible scars.
Right, right. Also, the brow
Yeah.
is heavier.
Right.
And less arched typically in men.
Yes, so you don't want to overlift the brow because that can give a feminine appearance.
Okay, interesting. And facial hair is obviously a consideration.
Yeah, you have to be careful not to damage the hair follicles when you're making the incisions.
Right, right. You also mentioned the malara eminence, which is
It's the cheekbone.
the cheekbone.
Yeah,
Less prominent in men.
right. And we often see some volume loss in the mid-face as men age.
Okay, so that might be something that needs to be addressed.
Yes, sometimes we'll use fillers or fat grafting to restore that volume.
Okay, okay. Deeper nasolabial folds.
Right, those are the lines that go from the nose to the corners of the mouth.
Yeah.
And they can become more prominent with age.
Okay. Jowl fat descent.
Right, so the jowls can start to sag and create that jowly appearance.
Yeah. Okay. And then increased laxity in the neck skin.
Right, and that can create that turkey gobbler look.
Yeah. And then finally, this point about skin vascularity.
Yes, that's important because men have a higher risk of hematoma after a facelift,
Uh-huh.
which is basically a collection of blood under the skin.
Okay. So, given all those anatomical differences, what are the goals then of a male facelift?
So the goals are really to restore youthful appearance, but to do it in a way that preserves the masculine features.
Right.
So we want to avoid any feminization of the face.
Okay. Okay. So you mentioned, enhancing volume in the deep malar.
Right.
And central facial regions.
Yeah, so that's important for restoring that youthful contour.
Okay.
But we want to be careful not to over-augment the cheekbones because that can give a feminine appearance.
Okay. Okay. Obviously, you want to preserve facial hair.
Absolutely.
And then, minimize hematoma risk.
Right. So we'll use techniques to minimize bleeding during surgery, and we'll also carefully monitor the patient after surgery to watch for any signs of hematoma.
Okay. Okay. So, preoperatively, what are some of the key considerations?
So preoperatively, it's important for patients to stop taking any blood thinners.
Okay.
We'll usually continue their blood pressure medications.
Okay.
And then sometimes we'll use a clonidine patch to help control blood pressure during and after surgery.
Okay. Okay. And then intraoperatively, what are some of the key things to keep in mind?
So we want to keep the blood pressure well controlled during surgery.
Okay.
We'll often use fat grafting to restore volume.
Okay.
And the incisions are placed very carefully to avoid damaging the hair follicles
Okay.
and to create a natural-looking result.
Okay.
We use a technique called SMAS plication,
What's that?
which is basically tightening the layer of tissue beneath the skin,
Okay.
and that helps to lift and support the tissues. We also use drains to help remove any excess fluid that might accumulate after surgery,
Okay.
and we monitor the blood pressure very closely throughout the procedure.
Okay, great. And then postoperatively.
So postoperatively, we'll avoid any medications that can affect blood vessel constriction
Okay.
for about 4 weeks.
Okay.
And then patients should avoid any strenuous activity for about a month.
Okay.
But we do encourage them to walk around
Okay.
to help prevent blood clots.
Right, and continue any blood pressure medications.
Exactly.
Okay, okay. Now, interestingly, you mentioned that men do have a higher rate of hematoma
Yes, that's right.
after facelift, but they also tend to heal quicker.
Yes, and I think that's because men have a thicker dermis, which is the layer of skin that provides strength and support.
Oh, interesting.
So even though they may bleed more, they also heal more quickly. And the scarring tends to be less visible.
Okay, that's good to know. You also mentioned that brow lifting tends to be more conservative.
Right, because we don't want to overlift the brow and feminize the face.
Right, right.
So we'll just do a very subtle lift if needed.
Okay, okay. All right, so let's move on to blepharoplasty now.
All right.
And this is number 3 on the list.
Yes, so it's very popular.
So very popular.
Yeah.
And again, there are a lot of male-specific characteristics that need to be considered.
Absolutely. So the ideal male brow is going to be, a little bit lower than the female brow.
Okay.
It's going to be a little bit flatter. Men tend to have longer foreheads,
Okay.
a receding hairline, and they often have these very deep wrinkles across their forehead,
Okay.
which we call rhytides.
Okay.
And then the muscles that control the brow, the corrugator muscles,
Yeah.
can be very strong in men.
Okay.
And so we have to take that into account when we're doing the surgery.
Okay. Okay. So given those unique characteristics, what are the goals then of upper eyelid surgery in men?
So we want to remove excess skin, of course.
Right.
But we want to do it in a way that creates a natural-looking crease.
Right.
We don't want to make the crease too high or too far medially, because that can feminize the eyes.
Okay.
We want to avoid a hollowing out of the area below the brow. And then sometimes we'll need to correct any drooping of the upper eyelid,
Okay.
which we call ptosis.
Okay.
And if the brow depressor muscles are really strong,
Yeah.
we may need to do a brow depressor resection,
Okay. What's that?
which is basically just weakening those muscles
Okay.
so that they don't pull the brow down.
Okay. Okay. So how is the surgery actually performed?
So we make an incision in the natural crease of the upper eyelid,
Mm-hmm.
and then we remove excess skin and muscle. We'll also remove some fat from the upper eyelid, but we do it very conservatively
Okay.
because we don't want to create a hollowed out look.
Right, right.
And then if the corrugator muscles are really strong,
Yeah.
we'll do a partial excision of those muscles.
Okay.
And sometimes we'll do some fat grafting
Okay.
to restore volume to the brow area.
Okay. Okay. And then for the lower eyelid, what are the main goals there?
So for the lower eyelid, we want to remove any excess skin.
Okay.
We want to remove fat from the 3 compartments of the lower eyelid.
3 compartments.
Yeah, there are 3 different areas where fat can accumulate in the lower eyelid.
Oh, interesting.
And then we want to improve the junction between the lower eyelid and the cheek,
Okay.
and then provide support to the lower eyelid.
Okay.
Okay.
And how is that surgery performed?
So we can either do a skin pinch excision,
Okay.
where we just remove a small amount of skin, or we can do a skin flap,
Okay.
where we lift up a flap of skin and remove more skin.
Okay.
And then we'll remove fat from the lower eyelid,
Okay.
and we'll often reposition some of that fat
Okay.
to improve the contour of the lower eyelid.
Okay.
And then we'll do a procedure called a canthopexy
Okay.
or a canthoplasty,
Okay.
which is basically just tightening the tendon that supports the outer corner of the eye.
Okay.
And that helps to lift the lower eyelid and prevent it from sagging.
Okay, great. And postoperatively for blepharoplasty, what are some of the things to be aware of?
So it's important to watch for signs of retrobulbar hematoma,
What's that?
which is bleeding behind the eye.
Oh.
It's very rare,
Mm.
but it can be serious.
Okay.
So we'll tell patients to avoid anything that can increase their blood pressure,
Okay.
like NSAIDs or aspirin.
Okay.
And then they should avoid any strenuous activity for several weeks
Okay.
and use lubricating eye drops to keep their eyes moist.
Okay.
That's important because the eyes can be a little bit dry after surgery.
Right. Right. Okay, great. Let's move on to rhinoplasty now.
Okay.
This is number 4.
Yes, it's a very popular procedure.
Yeah. It seems like managing expectations is particularly important here
It is.
with men.
Yeah. I mean, men can be a little bit more challenging to treat with rhinoplasty.
Oh, how so?
They may not have as good an understanding of their nasal deformity.
Oh, okay.
They may have difficulty articulating what they want,
Right.
and they may have selective hearing. They may hear what they want to hear.
So it's really important to have a very thorough consultation with these patients and to make sure that they understand the risks and benefits of the procedure.
Right, right. Okay. And what are some of the typical characteristics of a male nose compared to a female nose?
So the male nose is typically wider
Okay.
and straighter.
Okay.
The tip is less rotated,
Okay.
and the chin is more prominent. So that kind of balances out the nose.
Okay.
And the skin is thicker.
Okay.
So that can make it more difficult to get a really refined result.
Okay. So what are the goals then of male rhinoplasty?
So the goals are really to create a subtle change that enhances the masculine features.
Okay.
So we want to avoid any feminization of the nose.
Right. Right. And how's the surgery performed?
So it depends on the individual patient's anatomy,
Right.
but we'll often do a dorsal reduction,
What's that?
which is just removing a hump from the bridge of the nose.
Okay. We'll do tip work to refine the tip of the nose.
Okay.
We may need to do osteotomies,
What's that?
which are just breaking the bones of the nose
Oh, wow.
to narrow it. And we may need to work on the septum,
Okay.
which is the wall that divides the two nostrils.
Okay. So it's quite an extensive procedure.
It can be. It depends on, the individual patient.
Right, right.
Okay.
And postoperatively.
So postoperatively, they'll have a splint on their nose for about a week.
Okay.
And they'll need to avoid any activities that could bump their nose.
Right, right.
And it's important to keep the area clean and dry.
Okay, okay. All right, let's move on to hair transplant now.
Okay.
And you mentioned follicular unit extraction, or FUE,
Right.
is really the gold standard now.
It is.
The older method, posterior strip excision, is pretty much obsolete now.
Yeah, pretty much.
So, preoperatively, what are some of the key things to keep in mind?
So preoperatively, it's really important to manage expectations,
Right.
especially with younger patients who may think that a hair transplant is going to cure their hair loss,
Right.
but that's not the case.
Right.
Hair loss is a progressive condition,
Right.
and so they're going to continue to lose hair even after they have a transplant.
Right. Right. So what we're really doing is restoring
Exactly.
to an area where it's been lost.
Right. And also educating them about the fact that their hairline is going to naturally recede with age.
Right.
So we don't want to create a hairline that's too low on the forehead because it's going to look unnatural as they get older.
Right. Right.
We also do a thorough exam of the donor area,
Right.
which is typically the back and sides of the scalp,
Okay.
to make sure that there's enough hair to transplant.
Right. Right. And the recipient area.
Yes, the recipient area as well.
Okay. Okay. And then obviously medical evaluation.
Right.
Make sure they're healthy enough to undergo the procedure.
Yeah.
Okay. And during the procedure itself?
So the procedure is usually done under local anesthesia with sedation.
Okay.
And we use a very small punch to extract the follicular units from the donor area.
Okay.
And then we make tiny incisions in the recipient area and insert the follicular units.
Okay.
And we're very careful to angle the hairs correctly so that they grow in a natural direction.
Right. Right.
And we also try to distribute the hairs evenly so that it looks natural.
Okay.
And we're careful to avoid creating a hairline that's too low.
Right. Right. Okay. And postoperatively?
So postoperatively, they'll have a bandage on their head for a day or two.
Okay.
And they'll need to avoid any activities that could cause sweating or trauma to the scalp.
Right. Right.
And they'll need to use a special shampoo and conditioner.
Okay.
And then the transplanted hairs will start to grow in about 3 to 4 months.
Okay.
And they'll continue to grow for up to a year.
Okay.
And then if they need further density, we can do a second procedure.
Right. Right. And you also mentioned non-surgical treatments.
Yes. So there are medications like minoxidil and finasteride.
Okay.
There's laser light therapy.
Okay.
And there are injections of platelet-rich plasma,
Okay.
or PRP.
And those can be effective in some cases.
They can be.
Okay, great.
Yeah.
Let's move on to gynecomastia now.
Okay.
This is number 2 on the list.
Yes, very common.
Very common.
Yeah.
Affects a lot of men and adolescents.
It does.
So what are some of the underlying causes?
So the causes can be hormonal imbalances,
Okay.
medications,
Okay.
drug use,
Okay.
weight gain.
Okay.
So it's important to do a thorough history and physical exam to determine the cause.
Right. Right. And, it can also be classified based on the degree of enlargement.
Yes. So there's grade 1, which is just a small amount of tissue under the nipple.
Okay.
And then grade 4 is severe enlargement with significant sagging.
Okay.
And then everything in between.
Okay. And what are some of the key anatomical considerations?
So the position of the nipple areola complex,
Right.
the fullness of the chest muscles,
Okay.
and any fullness in the outer chest or armpit area.
Okay.
So we want to create a natural-looking chest contour
Right.
that's masculine.
Right. Right. Okay. And how is the surgery performed?
So we typically use liposuction to remove excess fat,
Okay.
and then we'll excise any excess glandular tissue.
Okay.
And then we may need to do some skin tightening
Okay.
if there's a lot of loose skin.
Okay. Okay. Postoperatively.
So postoperatively, they'll wear a compression garment for a few weeks.
Okay.
And they'll need to avoid any strenuous activity for a while.
Right. Right. Okay. Let's move on to abdominoplasty now.
Okay.
Tummy tuck.
Yes.
Number 5 on the list.
Right.
And men who present for this procedure tend to have some common characteristics.
Yeah, so they tend to be heavier
Okay.
and older than women who have tummy tucks.
Okay.
They're often more concerned about specific areas of the abdomen,
Okay.
like the love handles.
Right. Right.
Yeah.
And they may have a higher amount of visceral fat.
Yes, that's the fat that surrounds the organs.
Right.
And it's not something that we can remove with liposuction.
Okay.
So we may need to do a procedure called a peniculectomy,
Oh.
which is basically just removing the excess skin and fat
Okay.
without tightening the muscles.
Okay. Okay. So preoperatively, what are some of the key considerations?
So we need to assess the amount of skin laxity,
Right.
the amount of fat,
Okay.
and the presence of any hernias.
Okay.
And we also need to discuss the patient's goals and expectations.
Right. Right. Okay. And what are the main goals then of an abdominoplasty?
So the goals are to remove excess skin and fat
Right.
and to tighten the abdominal muscles.
Okay.
And we can do this with a variety of different techniques,
Right.
depending on the individual patient. Okay. And postoperatively?
So postoperatively, they'll wear a compression garment for several weeks.
Okay.
And they'll need to avoid any strenuous activity for a while.
Right, right.
And we'll monitor them for any signs of complications, like bleeding or infection.
Okay, great. Let's move on to liposuction now.
All right.
This is number 1.
Yes, it's the most popular procedure for men.
The most popular.
Yeah.
And there are some specific considerations here for men.
Yeah, so men tend to have firmer skin than women.
Okay.
And their fat distribution is different. They tend to accumulate fat in the chest, the
Right.
flanks,
Yeah.
and the abdomen.
Okay.
And if they have a BMI over 30,
Okay.
we need to consider the amount of visceral fat they have.
Right.
Because that's not something that we can remove with liposuction.
Right. Okay. So, how is the surgery performed?
So we make small incisions in the skin,
Okay.
and then we insert a cannula.
Which is basically a hollow tube,
Right.
and we use that to suction out the fat.
Okay.
And we're very careful to avoid any damage to the surrounding tissues.
Right.
And then we'll use a compression garment after surgery to help reduce swelling.
Okay. And post-operatively.
So postoperatively, they'll wear the compression garment for several weeks,
Okay.
and they'll need to avoid any strenuous activity for a while.
Right.
And we'll monitor them for any signs of complication.
Okay, great. And then finally, buttock augmentation.
Okay.
This is number 15.
Right. So it's not as common as some of the other procedures.
Right, but it is something that that men are requesting.